when we think about capitalism, we rarely think of how it acts on the body, right? When you are a laborer, your labor acts on your body, right? When you are a consumer under capitalism, those things act on your body, and they have long-term effects that we then manage socially. And managing that under capitalism is also like incredibly fraught and difficult.
Yeah. I mean, I was just thinking, the what you just brought up about, people who survive overdoses and then are disabled or, live with the after effects. That's something that obviously isn't captured even in the horrifying statistic of 100,000 deaths over a year. And, to go back to what Ariella brought up, during your segment, Ariella, like that's also something that our incredibly broken for-profit healthcare system is completely unequipped to deal with.
Tell me about it. I mean, you guys, I think that you're lucky to not see the guts of this Facebook group that I'm in. But I think there's a larger story here about the extended horrors. If your loved one doesn't die of an overdose and your loved one instead survives an overdose, but is not, perfectly healthy afterwards, which is common, I think that then you have to deal with the insane healthcare system. And what my family has had to deal with it. It's been insane, even though my family is like well resourced enough to navigate it better than most people, because it's just insane. And then people who don't have any resources, it's like, well, shit out of luck. Like you can put your loved one in a long-term care home, or you can take them home and take care of them yourself for the rest of their natural life, or yours, whatever ends first. It's completely arranged.
Yeah. And the other thing is, there are barriers to people getting these public services purposefully, right? And there are barriers to people getting the service that their insurance company should be guaranteeing them because they're paying their premiums. But then the broader narrative is like, be a good, responsible individual and just like get the thing you need from this system that's hell-bent on stopping you. So in the stories that I read for my piece, you'd have people who want to get treatment. For my job, like administrate, I don't know, all manner of like boring, awful, bureaucratic things like the healthcare plan or the 401k or whatever, because I do accounting. So I know how awful and like shitty this stuff is because I do it all the time. But when it's my own like health or my children's health, the stakes are crazy. Being in a position where you are desperate and then being told like, figure out if you need prior approval, then call the hospital and see what doctor has your chart, then figure out if that doctor can talk directly to the insurance company, which you can't get in touch with because you've been on hold for 2 hours. It's like asking somebody to complete like you should be a medal triathlete and then I'll approve your disability. Like it is such a huge, insane ask on purpose. And I think you're absolutely right. For every lethal overdose, there are non-lethal overdoses. There are people who are crushed by grief from witnessing just horrific things, who will have, a long-term mental illness or post-traumatic stress disorder that they need treated. And for us to continue to sit back and think that like individuals should be shouldering this and handling it on their own and not thinking that it will compound the very same dynamic, it is just unbelievable. And I think you're right. Like the left needs to catch up here. This is a massive, massive health crisis. And we need to be able to say like, we have a materialist position, but we also have a moral position. We're not going to be the people who sit back and, stay silent throughout all of this.
I want to quickly read a line from one of your articles, Meagan, because I think that kind of pulls everything together, what we've been talking about so far. So you write in your article, whatever else our drug policy consists of, it won't be sufficient to end the drug epidemic until we start investing in better life options for people who feel that they have few and work to give a sense of direction and purpose to people who have none. clearly drug policy has to be about much more than just the drugs themselves, right? I mean, I feel like that's what we've been kind of dancing around. And to go back to something you said earlier, Meagan, like I agree, the left isn't good at talking about drug policy. Like I feel like our go-to is harm reduction and decriminalization and the war on drugs. And like obviously, like I broadly support all of those things, but in light of how massive the opioid crisis is, has been, and will continue to be, it just seems so insufficient. So this is kind of like the dry question, but and I'm putting it to both of you, but like where do you think the left goes in terms of drug policy from here?
Well, I mean, I was sort of implicating myself here in not being entirely well prepared. I've written, I don't know how many articles for Jacobin, but I have to admit that despite having written several articles about drug policy, that's a really small minority of the articles that I've written for Jacobin. It's something that I've taken more of an interest in lately for personal reasons and also for political reasons, because it's becoming clear to me that this is an issue that is not a sideshow issue and that the left is not really good. It doesn't really have answers. On the one hand, I feel like the thing that you quoted that I said is a cop out, because it's like, well, maybe we should just make like a nicer society, and then maybe people won't be like be inclined. Like,
I was gonna say the reason why that line appealed to me, the reason why that line appealed to me is because it's like classic Jacobin, right? Like you have a problem, social democracy.
But see, that's what I'm saying. Is like on the one hand, it's a cop out, and on the other hand, it is the indispensable missing ingredient. Whenever you like, it is the actual. It's like kind of feels like a cop out because it's asking for us to like have a much bigger vision to solve the problem, which feels like we're getting away from the like, okay, well, what do we do right now, considering that we're in a crisis? At the same time, I don't see how we get out of our cyclical crises. Like I said, now we're in the third wave of opioid epidemic in the United States. I mean, who knows how many more are coming? Who knows what monstrous new inventions are lurking around the corner? I mean, we honestly have no idea. And if we think that this is the last of it, I think that's incredibly naive. There's no reason to think that this is the last of it. Like the title of the article that I wrote is "Fentanyl is the Genie That Won't Go Back in the Bottle." Certainly, this is a technological innovation. That's what this is. This is a technological innovation that is changing and shaping the world that we need to figure out how to live in relation to. And we need a big vision to combat that. Like, I actually do think that the left should get better on some of the specifics of drug policy. And I actually totally hold myself, like, I think I need to be held like responsible for learning about, what are the precise like platform bullet point issues that we want to accomplish. But I think we all know that that's just like a Band-Aid on a bleeding head wound until we actually like try to build something like a decent, halfway decent, borderline social democracy in the United States.
Yeah.
Well, I mean, something that you basically pointed out, Ariella, is that Medicare for all would go a long way, and again, that's something that's much easier said than done. I mean,
yeah, but we need to triage this problem. Like every single day, people are dying, and we can find ways to stop some of that. Like there are concrete things that we can do to stop some of that. If addiction treatment was free and you could just walk in and say, listen, I need support, and have it be there long term, that would change so many things. The fact that employment is a barrier to treatment means that anybody who is unemployed is already facing an additional barrier. The fact that even if you are employed, insurance companies can decide what they'll cover and how they'll cover treatment. The fact that you can't take paid time off to be treated for addiction issues. All of this is compounding the lack of resources that people are facing and making it more difficult for them to turn away or ask for help. I think that we also kind of take for granted that even though we want big changes, we can't do smaller changes like on the ground. So in my community, there's a big fight right now to reopen a treatment center because it was closed during coronavirus. They said for health reasons, and it was never reopened because they wanted to save that money and put it to something else. We have a lot of municipalities that are deeply underfunded. We're going to be seeing cities, facing bankruptcy over and over and over again as a result of the pandemic, but also as a result of local tax laws and so on and so forth. And so what you get are really desperate localities, but we have more power there collectively. And we may not have the power right now politically to have universal health care, and that would go a long way, but we do have the power in our communities to say, like, listen to the nurses, listen to the doctors, listen to the people who are professionals who want to treat this crisis, and give them the things that they're asking for. And right now, hospitals are being underfunded and closed. And so, where I live, it's really a bipartisan issue. People on both sides of the aisle are working together to try to make sure this treatment center reopens. These are the kind of small scale things that we can do, but it has to be the place that we can start. We have to start where we have power and work to keep building it. And then when we get there, be strategic about how we use that. But it does seem like so broad and vast that it's like David and Goliath. We are small on the left. Luckily, I think we can have a lot of allies, especially on this issue, because it affects so many people. But we need to be really clear about what our position is and what future we're looking forward to in carving out programs and trying to change things.
Yeah.
That's a little plug for listen to your nurses.
Right. Yeah. Always.
And I also feel like in the post-Bernie moment, maybe people are getting a little bit tired of hearing us say like Medicare for all and good union jobs, but like Medicare for all and good union jobs.
Yeah, sorry.
That's actually,
sorry.
I'm sorry if it's boring to you now, or you feel that we've moved on from this, but the answer is Medicare for all and good union jobs, in addition to all of the very the specific local interventions that need to be made on like drug policy specifically, like Medicare for all and good union jobs.
Yes. Yeah. Because we need to draw those links. They're like, our programs shouldn't be towards some like speculative future where, all people are represented equally and like everybody gets to hold hands on the red carpet and so on and so forth. Like, we really need to be saying, in a country where both political parties pander to the most bullshit talking points that don't relate to working people's lives, we need to be saying like, this is the answer. The answer is ending for-profit healthcare. It is a travesty. It's barbaric, it's cruel, and it's wasteful in every possible sense of the word. But it can get muddled. Like, we're the ones who have to say, when you're looking around your community and you're seeing maybe every other month a person overdosing, or you're seeing a person that you loved becoming more and more precarious and desperate, we do know how to fix it. Our timeline might not be next year, and it might not be in 5 years even, but we do know that. And it's a responsibility for us to not close our eyes to the horrors around us and to actually say, like, we want a world where it's not possible anymore. Because Meagan, you're right. It is a technological change. And on top of that, you have this really unfathomable power differential between normal people and what a normal person can do and fight for, and like a corporate entity like the Sacklers or even a cartel. We don't have the same tools in our pocket. We don't have the same political or legal power. It's going to be a really, really long fight. But like, on the left, we've got to be like, we are the ones fighting it.
Completely agree.
All right. Well, I think that was our last question for you, Meagan. Again, Meagan's articles in Jacobin. She has a few on the opioid crisis. The one we talked about in most detail today was fentanyl, the genie that won't go back into the bottle. And also check out Ryan's article, the one that you brought up, Meagan. That article is really good. So again, thank you, Meagan, for joining us today. And
thank you, and thank you guys so much for covering this issue. I think that like my final note on this, that I agree that we need to be taking more ownership over this issue, even if we don't have the specifics worked out, and we like maybe need I think we need to maybe put the cart before the horse on this and actually start taking ownership first and then working backward. You know what I mean?
Right.
Because that we can't just sit on the sidelines and just let the technocrats say that they have the like wonky solutions to these issues. I mean, we have to be putting forward an ambitious vision, because we know that's going to be necessary to actually stop the cyclical and mounting crises that we're facing. So I'm glad that you guys are covering this. I want us to be covering it more in Jacobin. We talked about it in our Jacobin editorial meeting last week. I think we're all on the same page here.
If you like this video from The Jacobin Show, please hit like and subscribe and share with your friends. Thanks.